All right, here we are post-op, folks, and it's 5 days, yeah?
6 days.
6 days. 6 days after the rhinoplasty you're watching right now. That's her, and that's her, and this is her. So these worksheets I use are just instrumental in telling me what I did so that I can basically know whether or not I want to do it again, if that makes any sense. And so again, from the side view here or the oblique view, you could see she had this dorsal hump kind of business. There it is there. Kind of gives it that longer appearing nose, and then what really appears as a short tip. So the distance between or relative to the ayla here, the nostril, and the tip is just much shorter than usual. And so in her particular case, it's sort of rebalance her nose so that the dorsum is lower, her tip is higher, and that alone will make a huge difference. On the frontal view, you'll appreciate mostly just the width of her nose. The tip here is pretty good. It'll be a little bit narrower. Okay, so then I come to my worksheet here, and on the worksheet, I show there's a hump reduction. There's an incision technique. There's a technique of trying to get her tip up here. There's a harvest of some of the septum in this region here to use right here. This red object is the columella graft that helps, think of it as a 10-pole that's designed to help the tip stay more projected, and some trimming of the cartilages and some roof stitches, and these little red dots out there are the fracture sites. So basically a combination of those activities. I wrote, again, this is things for me to sort of learn from, because it's like you do a lot of these, you have to keep learning. It says I rebalanced the nose and it went well, which basically said that no matter how I look at her, the whole balance of the nose is going to be considerably different. I got the tip up with the support of a strut, which basically is that graft that I put to hold the tip up. Otherwise, her tip just doesn't have enough strength inherently to resist the forces of healing, and as much as I could sort of get it up on the table, it'll sink back down without the support of this structure here. I said the dorsum was more bone than usual, which means that the proportion of this part of her nose was more bony than cartilage, which is just a variation of normal. I noted here that she had pretty wide nasal bones, and so the fracture was pretty generous in order to get them in and all that kind of stuff. And the only thing that I was curious about her, and that's why I asked her about her breathing here, is that when I did narrow her nose with these bones, since her bones make up a bigger proportion of her nose, I wonder if that was going to affect your breathing a little bit. Not a good judge right now because it's early after your surgery, but down the line I would like to know if that affected her breathing a little bit, because it narrowed pretty significantly. I wrote here delta is equal huge. Delta just means the change, so the change in her nose that she had versus what we finished with is a big difference. We know that now she's super swollen. And I also reduced the spur on the side of her nose to help her breathing, by the way. So I just pulled all your nose apart with just these stitches. Okay, good. All right. So she's real sticky. When I pull this off, everything kind of pulls up. So now I'm dealing with her. And so what you can clearly see, I think, with this camera here, that's a nice straight dorsum, and you can see the tip is definitely up higher than the dorsum. She's still got a ton of swelling in the tip right here. That happens because it's the only place that is not supported, so therefore all the water tends to stay in there. But I can definitely get an idea of what's going on here in terms of the shape of her nose. Now, also I could tell you that this tip doesn't move that much, because partly it's because of that cartilage graft that I have in there that holds it up. And it's much more narrow, for sure. Yeah, that's gonna hurt. And it's much more narrow, and she's pretty darn swollen. But you get the idea that the rebalance of her nose is that the tip will be the highest part here. It'll be acute and small, and she has a nice straight dorsum, and the base here is narrow. So these are the kind of home run features that we hope for. And like I said, you know, it's the gift that keeps giving, and as time goes on, this is just going to get cooler, which is super nice. So,
you want to see?
Oh yeah, let's her.
Remember what you had, okay?
Yeah.
And you're
And
still
you could
swollen.
look in, oh, super swollen. But you get the idea. So here, let's just, yeah. So most of the, so look at, you could see that change on her nose, and yeah, you're staying there so people can see. But so that hump is gone. She's straight. I just pulled up a bunch of the skin so she's going to settle down, and her relationship down on the bottom of her nose is much different, much more graceful, if you will. And this, you can see that, right? You can see she's got a little bit of a, well, it's like a Rudolph nose almost, you know, Rudolph the red-nosed reindeer. I mean, she's got a lot of swelling on the tip, and once that swelling goes down, that's just going to be amazing. And she's got a nice straight dorsum, and the bones themselves, the width of her nose is far more narrow.
Still feel like me.
I mean, you look at those pictures, and you see she just looks different. Yeah, well, it's kind of cool because it really does affect the balance, and she's drop dead gorgeous. And now we just make a nose that sort of fits. You know what I mean? All right, so what we're going to do now is my nurse is going to take out these stitches, and then I'm going to come back, and then we'll show you how we tape the nose, and I'm going to take a look on the inside because I did some inside work, and we're going to just kind of assess the swelling and stuff on the inside. Okay, so what I'm doing now is just kind of cleaning her up. I took out a transfixion stitch on the inside, and I'm going to show everybody how to tape the nose and the reason why we tape the nose. And she's sensitive. The skin here is super sensitive, and I think her breathing's going to be fine. She was a little clog-oly because there's this lot of swelling right now, and then she had just all this junk. So we're cleaning her up. The little stitches on the inside of the nose, they come out by themselves. All right. Okay, so now we're going to show you how we tape this up. Okay, so the purpose of the taping is to control some of the swelling of the nose and to help shape the nose as well. So these are just steri strips. These are from the 3M company, and you can get these pretty much anywhere. And what we're going to do here is apply these steri strips to the nose in a proper fashion. So the first one I'm going to put just in the mid part here of the nose. Again, this is to control the swelling. The next one is more important, and it goes a little long. It goes right above the tip. So the tip is here. This is right above the tip. And this is to kind of give us a little bit of a break from the tip below the nose. All right? Boom. And this is the tip here. So once I have those two steri strips, I take a full length steri strip. And what I'm doing is I'm putting it on one side, coming around the tip, but I'm not letting it stick. Coming along the other side. Whoop. Okay. Boom. Right? And then this is the important part. So I'm trying to squinch that tip in, and how you do it, you hold your finger here and you squinch that up. Woo! Yeah, if you don't have that reaction, you didn't do it. And so the whole idea is to bunch up that tip so that it stays nice and small. Okay, so again, the first one is in the mid part, the second one is just above the tip, and then this third one you lay on either side, and then when you get the end here, you squinch it up so that this tip right here is this little ball, okay? And you do that at night or during the day for a few weeks if possible, 3 to 4 weeks depending on, and that helps to control the shape of your nose. So you don't have to go out in public in this, you just need to wear it at night so it just controls the shape of the nose. As the cartilages on the tip that I made are healing up, this helps to keep them where they need to be so we get that perfect nose that we want. So she's well on her way. How's your breathing now? A little bit better?
Yeah, it's actually better.
Yeah, well, I guess.
Since we took out all that stuff.
Yeah, take out the garbage and look what happens now. You know, it's like you could, yeah. And so I think her breathing's going to be just fine, actually, because I did some internal adjustments on the inside of the nose as well, just to make sure that she has good breathing. So anyway, this is the second part of this video, and the next part will be maybe a little visit. You're from
Laredo.
Oh, Laredo, man.
Yeah.
So that's a little bit of a,
It's a little bit of a drive.
yeah, it's a little bit of a drive. Texas close though.
Yeah, that's right.
What we may do, depending on the factors, I mean, if she's coming here to Austin to hang out, then we can always get her pictures then, or she can actually send us pictures. I mean, what I realized over the years is that you people are actually really good at taking pictures. You know what we need to do is send her the pictures that we took.
So that way she can...
And then she could try to capture the same thing, with and without makeup. Just things that would give some people sort of an idea of, you know what I mean?
Even transformation.
Yeah, that transformation. Try to get the same pictures in the same angle so you can see that transformation. So we'll play it by ear. And if her boyfriend doesn't recognize her, that's not my fault.